This is Primary Ciliary Dyskinesia by Aspen and Taylor. Let's start with the respiratory system. The respiratory system is used to help you breathe and circulate oxygen throughout your lungs. Your lungs are the main organ in the respiratory system. They take in oxygen and you breathe out carbon dioxide. RBC, or red blood cells, take in the oxygen to the rest of your body and then return with all the carbon dioxide waste that your tissues and other cells don't need anymore. The diaphragm is a dome-shaped muscle underneath the lungs. When you breathe in, it flattens out and pushes down, and when you breathe out, it expands and forces air out. The trachea is your windpipe, and the bronchi are the tubes that break off the trachea that lead into the lungs. If we look here, we can see a few more things of the respiratory system in a diagram. We've got our nasal cavity, the oral cavity, the epiglottis, the larynx, the trachea, the bronchus, the right lung, and the left lung. So we can see here, we've got our trachea, our two bronchi are back here. I don't know if you can see them back there or not. We have our lungs, and we've got our cavities up here.
What is ciliary dyskinesia? Ciliary dyskinesia is a disorder in which cilia and flagella, which are microscopic hair-like structures, are unable to perform their necessary tasks. The lack of normal cilia can lead to the buildup of fluid, bacteria, and particles in the lungs. Around 12% of those with primary ciliary dyskinesia also have a condition known as heterotaxy, or situs ambiguus. This is where there are abnormalities of the structure and or placement of organs such as the heart, the liver, the intestines, or the spleen. About 50% of those with primary ciliary dyskinesia have situs inversus totalis, which is the mirror image reversal of their internal organs. This disease can also lead to infertility. In men, the flagella are unable to propel the sperm towards a female egg, and in females, infertility occurs due to abnormal cilia in the fallopian tubes.
So in these diagrams right here, we can see our cilia and flagella covered in mucus and stuff that controls everything that would be causing infections and stuff. And then we also see the lungs that have all the mucus that is pressing onto the lungs, making it hard for us to breathe, making it hard for them to breathe.
How does it interact with the respiratory system? One important function of cilia is to push mucus in the lungs towards the throat. This is so that it can be coughed out or sneezed out, so it's not in your lungs building up there. With primary ciliary dyskinesia, the cilia is either unable to do this completely or just unable to do it correctly. In newborns, PCD causes breathing problems at birth. This suggests that the cilia also play a role in removing fetal fluid from the lungs. Starting when they're a child, people with PCD will develop frequent respiratory tract infections. This can lead to bronchiectasis, which damages the bronchi and causes life-threatening breathing problems. Causes of PCD. Primary ciliary dyskinesia is a very rare disease that's passed from parent to child through genes. There is no single gene that causes PCD. However, many genes are associated with this disease. Normally, a child must inherit faulty genes from both parents in order to have PCD. With PCD, faulty genes can cause the cilia to be the wrong size, be the wrong shape, or move the wrong way. the cilia could also just be completely missing, not there at all. And if a child inherits the faulty genes from only one parent, they may be a PCD carrier. If this is the case, it is likely that they would not experience any symptoms, but they would still have the ability to pass it on to their children.
Symptoms for primary ciliary dyskinesia include respiratory distress in infants or newborns, specifically newborns, chronic coughing, pneumonia, bronchitis, and or any other recurring infections in the lungs, excessive mucus and difficulty clearing the mucus, ear infections, hearing loss, sinus infections. This includes severe sinus infections, cold symptoms, lack of response to antibiotics, meaning like penicillin or any of the common cold antibiotics that are prescribed. Diagnosis for primary ciliary dyskinesia. It's actually extremely hard to diagnose because it often is mistaken for atypical asthma or cystic fibrosis. Doctors often must piece together the patient history and symptoms to diagnose correctly. Cardiogenic disease syndrome, which is the left and right mirroring of the heart and or abdominal organs, is closely correlated with PCD. So patients sometimes may have this, or it is often seen in a lot of patients who have PCD. And a lung biopsy is used to confirm the diagnosis. We can see in the picture over here what a lung biopsy looks like. Treatments. There is no treatments. Well, there's treatments, but there's no cure for primary ciliary dyskinesia. If closely monitored when the patient first catches it, and if it's early enough, they can live a long, full life. Doctors focus on preventing the progression of PCD and keep proper lung function. All are closely, patients are closely monitored so that they won't prevent bronchiectasis. Airways must be cleared daily, so therapists use methods to help clear the mucus out from the lungs, so that because of the excessive amount of mucus that keeps coming through. Also, mucus holds live bacteria, and the patients must use antibiotics to control the infections, meaning not the ones that you would get for common cold, but there's a little stronger ones. Other medications include steroids, bronchodilators, and mucolytics, which are mucus thinners, which help with the removal of the mucus. And we have our last citation page with 5 citations with websites from all different